A mallet finger injury is a rupture of the extensor digitorum communi at the lateral band insertion. There are three different types that can occur. It includes a rupture of the extensor tendon, a small avulsion fracture of the extensor tendon that is less than 50%, or a large avulsion fracture that is greater than 50%. The mechanism of injury is a forced flexion injury resulting in overload to that extensor digitorum communi tendon. Typically, this will be during a sport when catching a ball, you have a miscue and it hits the tip of the finger. It can also be due to a direct blow to that insertion. Signs and symptoms include a flexed DIP joint. The flexor digitorum profundus actually pulls that joint into flexion because it is unopposed by the EDC. There will be pain and point tenderness at the insertion of the EDC on the distal phalanx, as well as loss of extensor function of the DIP joint. Diagnosis will be through an X-ray. Treatment will depend on the type of rupture. If it is either a rupture or a small avulsion, it will be conservative treatment consisting of a dorsal splint in extension for 6 to 8 weeks. We want to make sure that we do not limit the PIP joint range of motion. If it is a large avulsion fracture, then that will require surgical pinning.